Hello, ladies. Thank you for showing up today. Hi, Brenda. Hi. I see a couple familiar faces. Sheldon, Denise from Arizona. Okay, so I'm excited to talk to you on this topic today, ladies, because I think it's really important. My name's Jami, and I work here at the Center for Anti-Aging and Hormone Wellness, helping women with their sexual wellness. You can set up one-on-one consultations with me if you so choose. So why would I want to talk about vaginal estrogen? Well, your wellness matters, and your vaginal health is an important part of your wellness. And I want to empower women with the knowledge to help them and help the other women in your life to really understand the importance of vaginal estrogen and what it can do for you. I think that what happens is a lot of women are never given the option of vaginal estrogen. And also, you may have gotten a prescription for vaginal estrogen and you were like me and you used it once or twice or didn't use it at all and just kind of stuck it in your drawer and forgot all about it. And you thought, no, this isn't for me. But I think if we understand the importance of it and what it does, I think that we'll be more excited to use this as a tool for our vaginal health. So let's talk about how we can turn back the age and function of our vagina. First, I think we should talk about what does a healthy vagina look like, basically. Acidic environment, the pH needs to be acidic. It cannot be alkaline or it won't be healthy. We need a high population of a very particular bacteria, lactobacillus. And we need a very low diversity of microbes. So what that means is in your gut, you need a high diversity of microbes for a healthy gut. But in your vagina, we want low diversity. We want mostly just this lactobacillus, but we want a very high population of that lactobacillus. We want a healthy mucus layer, and that's very dependent on our hormones. And we would have a thick lining and good vaginal secretions. So that is basically what a healthy vagina might look like. So what happens when our hormones start to deplete to our genitourinary system? Now, we're not going to talk full body here. We're just talking genitourinary, and there's a lot of things that can happen. So first of all, our pH increases. It becomes more alkaline, which remember we want it to be more acidic. And we start to lose our good bacteria, our lactobacillus. And our mucus lining that makes the glycogen, which is the food for our lactobacillus, our glycogen starts to decrease. So now we don't have as many good bacteria and we don't have the food for the good bacteria. We have the wrong pH. And what starts to happen is, and also we get a higher diversity of microbes. Remember, we don't want diverse microbes in our vaginal canal. We want mostly lactobacillus. So now more of the bacteria, say from our gut, are getting into our vagina and it is creating problems. And what can happen? We could start to have recurrent urinary tract infections. A lot of people do not realize that their lack of estrogen is the cause of their chronic urinary tract infections, and just getting onto vaginal estrogen may be the cure for them. You can become more vulnerable to chronic vaginal candida, HPV, bacterial vaginosis, even things like herpes and chlamydia and other sexually transmitted diseases and infections, because our lining, our wall becomes more atrophic and thinner, and things can get in there and settle in more easily. We can start to get even possible gut disturbances just because there's a lot of crosstalk between your vaginal microbiome and your gut microbiome. They talk back and forth. And so if one or the other is disrupted, the other one can become disrupted. We can get clitoral atrophy. It's like a wasting away. We can get anal atrophy and fissures and hemorrhoids. We can get a decrease in the folds in our vagina, which equals less elasticity, and that can equal more painful sex. How many ladies on this call, you don't have to raise your hands, but how many ladies actually experience painful sex? I bet you it's a lot, and that might be why you're here. And I'm here to tell you, none of you are alone. This is very, very common. You get a decrease in blood vessels. When you have a decrease in blood flow to the area, not enough blood's getting to the tissue, that will equal less sensation. Less sensation will equal less pleasure. You can't feel it as much. You're less orgasmic. So maybe you could have an orgasm before. Now you can't have one at all. Or maybe you start to have one, but it just all fizzles out. Okay, these are things that can happen from not having enough blood flow, which creates that lack of sensation and pleasure. Painful sex, like we said, dryness, vaginal muscles can become lax, decreased sex drive, you can have itching and irritation. there's just a host of things that can happen as our estrogen depletes in our genitourinary system. So in comes vaginal estrogen to the rescue because it works so very well for all these issues. And vaginal estrogen is low dose and it's used vaginally. And like I've been saying, it helps the whole genitourinary system, not just our vagina or externally our vulva, but it helps our bladder as well. Up to 87% of women can get genitourinary symptoms of menopause. So that's a lot of people that are going to experience these one or more of these issues when they have a drop in estrogen. And this can start in perimenopause. It can start right post-menopause. It can start 5 to 10 years later. And once you have these issues, such as vaginal vulva dryness, pain, itching, urinary frequency, leaking, possible chronic urinary tract infections. Once you have this condition, it's not going away on its own. You're going to need some help. And vaginal estrogen is like skincare for the vulva, the vagina, the bladder, and it's great for your pelvic health too. Now, ladies, this is not hormone replacement therapy. This is not optimizing your full body hormones when you use vaginal estrogen. There is an estrogen ring that some women use that is full body estrogen, but that's really not what we're discussing here. We're talking about low dose vaginal estrogen that stays in the whole genitourinary area. There's very minimal systemic absorption, if any at all. It will not raise your estrogen levels in a blood test. And that's important to understand. So what are the benefits of using vaginal estrogen? It's going to be to help all those things I just talked about, but in general, helping with dryness and pain. It'll help support the pelvic floor, help support skeletal health and musculature of the pelvic floor. It will help with incontinence, leaking, helps with urinary tract infections, which, by the way, ladies, if you didn't know that, it kills people, urinary tract infections, especially as women get older. They end up in ICU. It creates a lot of issues. It can help with sexual dysfunction, arousal, and orgasm. If your urethra, which is where you urinate from, if that has started to protrude and stick out from the decreased hormone state, then vaginal estrogen may help with that. Can help with bacterial vaginosis. Can help with all the things that we previously kind of went over, that when we have a lack of estrogen, that can happen to us. So when should we start considering vaginal estrogen? Well, if you're having symptoms, ladies, ask for a prescription. Now, if you're with Dr. Peters, you may already been offered this, but you might have to just ask your doctor, whichever doctor. It can be your family doctor, your OBGYN. Either of those could prescribe for you. Also, I think by the age of 50, 55, you should just consider going on it prophylactically. Why allow these tissues to become atrophic and thin when you can kind of head it off? It's kind of like we use skincare to try to keep our skin healthy and less wrinkled and, as we age. It's the same concept to me with vaginal estrogen. You could think of it as skincare for down there. So before you even have the issues, you could definitely get started on it. And then women who are on birth control pills will sometimes have dryness from lack of estrogen, might be able to consider doing vaginal estrogen, or if breastfeeding, that can decrease the estrogen. That's also a time it might be a good option. Any condition where the estrogen is depleted in the body, the vaginal area, that would be when you could consider vaginal estrogen. So why hasn't your doctor prescribed you vaginal estrogen? Or why won't he? Well, again, if you're with Dr. Peters, he will, and he probably has. But the truth of the matter is, ladies, many doctors are not taught about hormones and menopause. I know that seems really strange, but it's just the truth. And that includes your OBGYN. And so they're really still affected by old information from the Women's Health Initiative, which is outdated. It's really outdated information, and it scared everybody about hormones in general and did women a huge disservice. That misrepresentation of the Women's Health Initiative study has really led to an irrational fear of all-female hormone replacement therapy by the general population and by physicians as well. I just need to. Okay, allergies. All right, so just understand that vaginal estrogen is hundreds of times less strong than systemic estrogen is. 1 year of vaginal estrogen is like swallowing 1 pill of systemic estrogen. Just to put it in perspective, it's very low dose. And pharmacists may also get in the way of your prescription for something like vaginal estrogen or either other hormones because they have a fear and a misunderstanding as well. And then the other thing that might kind of get in the way of you using vaginal estrogen or the doctor's prescribing it is the black box warning. Now, ladies, there's no data to support the risk of breast cancer for vaginal estrogen. It's mislabeled packaging. And this is not based on contemporary data. It's based on that outdated information from the Women's Health Initiative. And that was for full body estrogen anyway. There are doctors working very hard to get this black label, this black box warning removed. And you can actually go to letstalkmenopause.org and you go under the section Unboxing Estrogen, and you can sign the petition to get that black box warning off of estrogen. And I encourage you to do that. I hope Dr. Peters and Brenda, I hope you guys will do that. That's letstalkmenopause.org, Unboxing Estrogen. I think it's really important that we are able to get the word out there, and so women aren't afraid to use vaginal estrogen. Another reason the doctor might not prescribe it to you is because you've had breast cancer, you're a breast cancer survivor, and the doctor's still running on old, outdated information. You need to go onto the American College of Obstetrics and Gynecology. That's ACOG for short, ACOG. You go onto their site, and they actually have a statement about vaginal estrogen being safe for breast cancer. So you print that off, and you take that to your doctor. Okay, then he doesn't really have an excuse, or she, I shouldn't say he, to not give you vaginal estrogen. And vaginal estrogen is over the counter in many countries, just to give you an idea, to be honest. Hopefully one day it will be here too. Let's talk about vaginal estrogen and bladder health. So here's one of the big takeaways I really want everyone to know here, because I think this is one of the biggest things that vaginal estrogens can do for us. Estrogen is the urinary tract infection prevention hormone, and that is important. And you need to spread that to your sisters, your mother, your aunt, your grandmother. You need to let your friends, you need to let other women know this if they're suffering from chronic urinary tract infections. Why are doctors chasing UTIs with antibiotics and not giving vaginal estrogen? It's crazy to me. Antibiotics create resistance and a host of issues for your microbiome, for your gut health, when vaginal estrogen can cure the problem. It's over a 50% cure rate for urinary tract infections. Now, this is not going to cure your urinary tract infection that you have at the moment. The whole idea is to prevent future urinary tract infections. So this really works. I had a family member suffering from urinary tract infections and finally listened to me and now does not get urinary tract infections. You should understand that if you're given Cipro for a bladder infection, one round can take a year to recover from taking those antibiotics. And it's like an atomic bomb for your urinary tract infection. If you have a urinary tract infection, you should wait for the culture and see what antibiotic you actually need. I made that mistake a year ago and I won't make it again because I went on antibiotic and I haven't done well since. And I got on my vaginal estrogen. It prompted me because I was one of those who got it, said, oh, I don't like this, stopped using it, didn't understand the importance of it. But boy, one urinary tract infection and I was sold and I haven't stopped. And of course, I haven't had one since. So without estrogen, when we're talking about the bladder, without estrogen, the vagina loses the ability to handle other bacteria due to an unhealthy microbiome, like we talked about. And that healthy bacteria also help protect our bladder from pathogens that can come from the GI tract. They may be good in the GI tract, but they're not good in the urinary tract. And then you can be more prone to urinary tract infections. Also, when the tissue thins, the urethra, which is again where we urinate from, that can get closer to the vagina. And now that it's closer, it's got an easier pathway for urinary tract infections. Also, vaginal estrogen is anti-inflammatory and it helps the smooth muscle of the bladder to relax. I saw this commercial and I got very excited because I think it was the girl from Grey's Anatomy and she's talking to her friend and her friend is like, I'm having leaking and I'm having, I guess it was leaking, I can't remember. But the other girl said, oh yeah, that happens from childbirth and menopause. And I got excited. I'm like, are they going to talk about vaginal estrogen? My ears perked up. And no, she pushes a box of poise pads across the table. I was so upset because, ladies, that's not the answer. I'm not saying we shouldn't use them if we need them, and I'm not shaming anyone if they need to use them. But when we have a cure for this issue, or at least part of the puzzle to help it, poise pads, let me tell you this, those pads, incontinence pads, are big business. I don't know how much they make, but I know it's in at least the millions. It may be in the billions. I'm not sure. I know it's a lot. So that commercial was really upsetting to me. All right, but let's talk about how do we use our vaginal estrogen? What is the best way to use it? Okay, so you're going to use 1 gram. Now, it'll come with a tube, like if you've ever had a yeast infection and you have that little tube that you screw onto your cap and squeeze it in, and then it'll go up and you'll see at the top 1 gram. So you'll know you have 1 gram. It's going to be a gram. You're going to insert and you're going to put it inside and you're going to push that in. And it needs to be 1 gram. A dab is not enough. A dab will not do you. And if it's used inappropriate, ladies, don't waste your money. Just don't even do it. It needs to be done consistently, and you're going to do that 2 times a week. All right. Now, the other thing you can do if you have pain at your 6 o'clock area, so if this is your vaginal opening, 12 o'clock, 6 o'clock. If you've got pain here, vaginal estrogen is shown to help with that pain. So what I want you to do is take a little dab and put it here. But honestly, where else would I put it? I'd put it all around the entrance. I'd put it up on the clitoral area and all around the whole area. Okay, now that's a dab, but not the internal. The internal's a gram. So a little dab around that area. And then one of the things you can do, I know not all of you will do this, but I think you should be aware that this could help because some people will complain, I hate when it leaks out of me the next day. Well, one of the ways you can help with that, after you insert it, you can insert your finger and you can rub it in. It's like rubbing in your skincare cream. It will go into the lining a little bit better and you might have less of that leaking the next day. And I know not all of you will do that, but some of you may, and it does help a little bit. But honestly, you get used to that and it's not as problematic over time. You don't notice it so much. It just becomes very normal. And like, I don't even think about it now. What you need to understand that's very important is that this can take 2 to 3 months to work. Maybe not. Maybe it's going to take a day, a couple days or a week, but it could easily take 2 to 3 months, and you must give it time. Now, if at that point it's not working, you can add another day. 3 days, that's okay. Maybe you need 3 days. We're all individual. We have different needs, right? So maybe it's going to be 3 days. You can use this with your VFit. So if you have a VFit, maybe use it on alternative nights of your VFit, or use your VFit and then insert your vaginal estrogen. One of the things some of you may be thinking is, what if I decide I put my vaginal estrogen in and the timing is right, the mood is right, and we end up wanting to have sex? It's fine. It's not going to hurt your spouse. It's just a little bit of low dose estrogen. They have estrogen in their bodies too, and it will be okay. It's not going to be problematic if that happens. I wouldn't suggest you do it every time, but if it happens, it's okay, ladies. It's not a problem. Okay, how long do we use this? Forever and ever and ever. Because if you stop, you're going to go back to having the problems you had before. Because remember, the problem doesn't go away on its own. It needs help. So there are other forms of vaginal estrogen besides vaginal estrogen cream. And one of them is pellets. Now with pellets, they're what they sound like. They're little pellets and they get inserted, typically nightly is how you'll use them. But one of the things you need to be aware of with pellets is there are some low dose pellets, and they may be too low dose of an estrogen to really do the job. So if you're using those pellets and they're not working well for you, first thing I would do is I would look and see, do I have a strong enough pellet? Maybe I don't have the higher dose like a vaginal estrogen. Or honestly, if I were using a pellet and it wasn't working, I might consider, is it falling out in the morning? Is it not dissolving the way I'd hope? I would probably switch to a vaginal estrogen if that's not working, just to try and see if something else works. And you, of course, you could talk to Dr. Peters or your doctor about this, but these are things I would consider. If you're using pellets, they're working well for you, I still would suggest you get a little cream and you can apply it externally like we talked about. There's also an E-string that can be inserted, and that can stay in there for 90 days. and that'll just emit the low dose estrogen. Now, that might be good for people with dexterity issues, or maybe somebody with dementia or Alzheimer's, or women in a nursing home. That might be a great way to prevent urinary tract infections. So you may have a loved one in that situation that you could, talk to the doctor about that. Now, there's two different types of estrogen used for vaginal estrogen cream, estradiol and estriol. If you're getting it from Dr. Peters, you're probably getting a compounded estriol. If you're getting your prescription from the pharmacy, it's probably estradiol. Honestly, I think either is fine. I wouldn't get too wrapped up in that because I just want women to get their vaginal estrogen. In other countries, I think in Europe, it might be estriol over the counter, but I just wouldn't get too worried about that. If you have a concern that the form you're using isn't working well, again, speak to your doctor. Just make sure that they are knowledgeable in this. Of course, if you're with Dr. Peters, he knows. He knows. So you could have that conversation. Now, there is another option besides vaginal estrogen. There's also DHEA. And DHEA converts into testosterone and some estrogen. And we do have a lot of androgen receptors in our vaginal canal and our vulva. And when I say vulva, that's the external genitalia area. And that works too. And if you have pain in the, like if this is your vaginal opening and out here, you're continuing to have pain and you've been using vaginal estrogen the way I had talked about and using it appropriately, and you're still having pain, maybe you could try switching to DHEA, see if that helps for you. It does help make the tissue feel soft and supple again. It might boost libido a little bit. And Dr. Peters can even compound your DHEA into your vaginal estrogen cream. I have that myself. And DHEA is best to use daily. I do this, I take a little daily and do apply it externally because I like to do that just for any of that pain around the opening. And honestly, I just want to keep that tissue externally healthy as well. But remember, it's just a little dab of cream that you would be using. Now, there also is a prescription DHEA called Intrarosa, but it's very expensive and insurance typically is not going to cover it. So that would definitely be a barrier to that. But Dr. Peters compounds, so you can get DHEA that way. So let's talk about some troubleshooting here. Let's say you are started using vaginal estrogen, you start getting itching and discomfort from the estrogen cream. Well, that could be the base that it's in. And so maybe you have to try a different base. So if it's not a compounded estrogen cream, maybe you could try a compounded estrogen cream, or they could also do an ingredient that's more for sensitive people, Versa-based. But that's what I would talk to the doctor about, trying to get your estrogen cream compounded into a different base if you're sensitive to what's in the regular estrogen cream. Maybe you feel systemic side effects after starting estrogen cream. A lot of people think that if that happens, they have to stop. And I've heard this from a lot of my skincare patients, and that's just not true. What happens is when you have a trophic thin tissue in your vaginal canal, you are going to get some of that absorbing. You're going to get a little bit more absorption. So maybe systemically that'll show up a little bit more, but as your tissue starts to get healthier and thicker, you're not going to have that systemic absorption in the same way. It's going to stop. And that can happen very quickly within weeks of using your vaginal estrogen. I was told by my doctor I'm not a candidate for estrogen cream. Well, the main reason you might have been told that is because of breast cancer, I would think. And so you can print off the ACOG statement that we talked about earlier. Remember, that's the American College of Obstetrics and Gynecology. They have a vaginal estrogen safety in breast cancer statement that you could print off and show your doctor. And honestly, the worst case scenario, if your doctor will not give you vaginal estrogen cream, is DHEA cream. You can use that. I'm using estrogen tablets and still have symptoms. Well, again, you might be using a tablet that is too low of a dosing for you, or maybe that pellet, if you notice that pellet's kind of falling out in the morning, like it's coming out when you go to the bathroom, maybe it's just not dissolving properly. So maybe you should try switching to vaginal cream. You could talk to your doctor about that. I started vaginal estrogen and got a yeast infection. Yeah, not fun, but keep going, don't stop. Maybe if you need to use some diflucan, you can use that, but keep using your vaginal estrogen because that's going to help overall. in the long term to keep that problem at bay. I want to talk about some myths with vaginal estrogen. First myth is can't use vaginal estrogen if you're using full body hormone replacement therapy. That I heard that recently. That is absolutely false, not true, and you absolutely can. And if my doctor told me that I couldn't use vaginal estrogen with my full body hormone replacement therapy, I would really question that doctor's knowledge, to be quite frank with you. So if that's the case, and you are some people may be here that aren't Dr. Peters' patients, I just want you to know, if that's the case, you reach out to me and I will give you a link to a video of a doctor talking about vaginal estrogen, and that class can be taken by other doctors so they can learn to get educated on vaginal estrogen. Next myth, I can't use vaginal estrogen because I have a history of blood clots and migraines. False, not true. You absolutely can. It will not cause blood clots. It does not create systemic uptake of blood. It's not going through the liver, which is how you can get blood clots. So absolutely not true. I cannot use vaginal estrogen because I've had breast cancer. Well, we've talked about that. Not true at all. I can't use vaginal estrogen because my sister, my mother, my aunt had breast cancer. Not true. Definitely not true. I've been told I don't need vaginal estrogen because I'm using hormone replacement therapy, full body hormone replacement therapy. Well, that might be true because maybe you're having no symptoms, you're feeling great, and your hormone replacement therapy is doing the job. Then maybe you don't need it. But chances are you still need it because with full body hormones, many times women still will have these issues and still need the vaginal estrogen. Having in-office treatments, I don't need vaginal estrogen. Having FemiWave or some kind of laser or something like that, you still need vaginal estrogen. It really helps that tissue to stay supple and maintain healthy vaginal tissue. It'll also help precondition and get your tissue ready, and you'll do better with your procedure. All right, so those are some of the myths I have. I would like to know if you guys have any questions. I do see a question here about VFit. VFit, I just did a webinar on VFit a month or so ago, and VFit is a wonderful device that uses red light therapy, vibration, and heat to really help restore the vaginal tissue. And I think that estrogen and VFit together, fabulous, a great dynamic duo. You can go to Dr. Peters' YouTube page, the Center for Anti-Aging and Hormone Wellness, and you can watch my VFit video that I did last month. So I welcome you to do that. We sell VFits here. We sell the VFit Plus, which is the professional version. It is not any additional money for the professional version, but you get an upgrade, and it works more effectively. It's got more power and it'll work faster. And if any of you, yes, a 77-year-old woman can definitely begin using vaginal estrogen and should. I'm going to come back to that in a second. If you all watched the menopause special with Oprah, now I did not watch that, but I believe Halle Berry probably talked about the VFit because she has her own version of the VFit, and I do believe it's a little more expensive. But I do believe that's also the non-upgraded version. So you can get a VFit Plus from Dr. Peters' office, less expensive than that version, and actually has more efficacy. All right, so that's important to know. And a 77-year-old woman can definitely start vaginal estrogen if she's got any symptomology. I have women who come in and tell me they're in their 80s and they itch and have so much discomfort. They're so dry, it hurts to walk. And so, yes, I would definitely recommend vaginal estrogen, and also to keep those urinary tract infections at bay. I think it's really, really important. Your sister's bladders fall into her vagina. Will vaginal estrogen help? Look, in that situation, when you have a prolapse, that needs to be addressed. Pelvic floor health specialist that specializes in the pelvic floor, and then also seeing the doctor. I think vaginal estrogen is still going to be beneficial for all the tissue, and I would still get on vaginal estrogen. If you want to chime in on this, Dr. Peters, if you feel anything differently than that, but pelvic floor health specialist and seeing the doctor absolutely is important. So please, if you have any other questions, let me know. Oh, hi, Dr. Peters.
Hi, Jami. That was amazing.
Thank you.
I'm so impressed. Every time I listen to you talk, I'm thinking you should just do all the talking and I'll stay quiet.
I love to educate. I'll do that all day long.
You're amazing. So anyway, thank you for doing this. Thank you to our staff at the office for making this happen. I know it's a lot of work for them too. And thank you all you ladies for joining us today. I think this was incredibly informative.
Did you have a specific?
You had a specific question about the about vaginal prolapse and stuff, right?
Yeah.
Yes. Vaginal estrogens work incredible for this. In fact, I get a lot of urogynecologists in the area and pelvic surgeons that refer patients to me to put them on vaginal estrogen before and after their surgeries to improve the tissue before they do surgery and then to maintain the surgical repair afterwards. So yes, it absolutely works well. Now if there's a stage 4 prolapse and unfortunately the bladder and the rectum are showing themselves outside, that usually requires surgery, but vaginal hormones can help prevent that from happening again and make the healing process much better.
Yeah, that's a great point, Dr. Peters. And like if you're having any kind of bladder surgery or pelvic, any kind of surgery down there, I think it would be great to be on the vaginal estrogen.
Yes. And to one other point, and then I'll stop and I want to let you continue. But I love the fact that you mentioned the estrogens combined with androgens, because adding DHEA, the DHEA actually thickens the skin a little bit in the vaginal wall, which becomes very atrophic and thin, as you mentioned. The estrogen component helps the lubrication process. So you put the two of those together, thicker skin, better lubrication. That's just a better overall vaginal environment all the way around. And I go one step further. I take a little bit of that androgen cream, whatever's in there, DHEA. Sometimes we put testosterone in there too. And they can, as you said, rub it around the opening of the vagina, and they can put some up around the top of the clitoris, around the clitoris. It enhances the nerve supply and the sexual response that way.
And doing that daily, are you okay with using a dab daily like that?
Yes. So I usually tell them when we start vaginal estrogens, I use them for every day for 2 weeks to get things woken up, get the tissues responding. Then we're usually able to back it down to the intravaginal hormone to about 2 to 3 times a week. But they can use the external little bit on the external surface every day. In
Right.
fact, when I prescribe topical hormones, I always tell them you could save a little bit and rub it around the outside of the opening of the vagina. It just moisturizes the tissues and makes them a little more lax and just more amenable to sexual relations and just overall feeling better.
Yes, I had another question as you said that. Now I forget what it was. Okay, that's
Well,
okay.
I'm here till you finish. So if you think of it, let me
If
know.
I think of it. Thank you for that though, Dr. Peters, because oh, I know what it was. So I think if a woman goes on it every day for 2 weeks, some people are going to find that they just don't want to do that. Like I used to always say that too, and I love that you do that. I think that's great. But if someone is doing it and they're really struggling to do it that often, would you just tell them do it as often as you can in the beginning, just to kind of try to get a dose going?
Absolutely. I mean, look at it this way. Anything's better than nothing.
Yeah.
Some women come in and they are so dry and uncomfortable.
Yes.
Sometimes giving the tissues a little bit of shock therapy every day for 10 to 14 days really helps wake things up, and then you could back it down. But if they can't do it, whatever they can do, it is going to be better than not doing anything, right?
I love that shock therapy. I can remember that.
Yeah, it's tissue shock therapy.
I love that. Yes. We need, in menopause, a lot of times we need a little shock therapy down there.
Yeah.
Okay. Anything else, Dr. Peters?
The other thing I really liked that you said was about, I see a fair number of patients who have had breast cancer, and these women are really suffering because everything you read on the internet and when they talk to their traditional doctors, it's absolutely, they cannot take estrogen. And I'm respectful of that. We're not renegades. We don't just add estrogen to people that shouldn't have it, but almost everybody can take vaginal estrogen. So, sadly, because they had breast cancer doesn't mean that's the end of their sexual experience. We use estriol, as you mentioned, which is a much milder estrogen. It actually blocks the specific receptors that stimulate breast cancer. So, and very little of it gets in systemically, as you've said anyway. But adding estriol with a little DHEA can make a world of difference for them. So just wanted to mention that subgroup of people who already are suffering a lot.
I love that. And also, if for some reason you just can't get doctors on board, there's always the VFit as well. And you can go back and watch that webinar on YouTube. The VFit is helpful. It's not going to add estrogen back to the tissue, but it can definitely help the tissue to become healthier. Okay, so someone asked how to get the recording. Ali will email out to the people who signed up for this recording. She will email out the link, but honestly, it's going to be up on YouTube within a few days to a week. She'll get it up there and then you can rewatch it. And I hope that you will recommend this to friends, family, mothers. I mean, please get the word out. As women, we have to empower each other and learn how to care for our own health. And you know, like if we get tennis elbow, we're going to rehab our arm. We aren't going to stop using it. And it should be the same thing. There's a lot of women who just stop having sex because it's just too painful and they don't know there's anything they can really do about it. And you shouldn't just stop using that area, that organ or that part of your body just because when there's things you can do. And I think it's so important to know that. Now, I did put my email in the start of this. I will type it in again. It is jderr.hormonewellness@gmail.com. And if you have any questions that you felt maybe uncomfortable asking here, or wait, what just happened now? Or you have a comment about this, then I would encourage you to give me a shout out. I got a few shout outs from the last video I did with the VFit. I appreciate anyone who's here that sent me comments. That was great. If there's something you guys want to really hear about, let me know. I mean, maybe I'll do another video on that. And stay tuned for some other things. Dr. Peters and I are going to do some things together. And know that you can come in and see me for a consult if you would like. And also kudos to all you who showed up today because you are taking the effort to learn about your body and how to care for yourself. And a lot of people just don't take the time and effort to do that. So good for all of you. All right, I don't see any more questions coming through. So I think that's going to be it for today. Thank you so much for coming. I hope you have a great, blessed day.